Happy National Health Center Week,
where federally qualified health centers are lighting the way for healthier communities today and in the future.
My name is Dr. Bahar Mohammed, CEO of HOFHC Family Health Centers. You want to introduce yourself?
And I'm Jen Schell. I'm the Director of Marketing and Development for Heart of Ohio Family Health.
And welcome to Heart of Ohio Family Health Center at Whitehall Yellen High School, our school-based health center. And we're going to take you into the tour of this facility to show you what we do for students and the community. And I want to ask Jen, how did we do the collaboration that actually gave birth to the school-based health center?
So this is a collaboration we've been working on for a couple of years with Whitehall City Schools. They've always been interested in providing health care to their students to help meet the needs of their students. And as a federally qualified health center, we already had a facility in Whitehall. We were kind of the perfect fit to serve the students here. We applied for a grant through the Franklin County Board of Commissioners, the Catalyst Grant funding, and we received that funding, which has made this school-based health center possible. The Whitehall City Schools also worked with the Educational Service Center of Central Ohio to help get renovation funds to turn the former enrollment center here into the health center now. And it was a great collaboration of many organizations and some funding opportunities that allowed us to make this happen.
So I'm going to take you on the tour of the school-based health center. So let's mask up and then we'll go through the tour. This is the registration area where a patient can come in and do their registration, as they're coming to visit the clinic, and then proceed towards the waiting area that I'm going to be showing you very shortly. And this is Sherry. Hi, Sherry.
Hi, how are you?
I'm fine. This is Sherry is a new medical assistant here at the school-based health center, helping us to see patients. Thank you for your work, Sherry.
Thank you.
All right,
Who's next?
Joyce.
This is Joyce. Joyce, say hi. Yeah, what do you do, Joyce?
I am going into the system to verify patients' insurance to see if they are eligible.
Thank you.
Verify patients' eligibility.
Absolutely. We're going to introduce you to one of our providers, so let's have a conversation. Why did you choose to work here as a nurse practitioner for the school-based health center?
I like that we're helping the kids, high school students. I thought that it was a good idea to reach out to them actually so they don't have to miss school, and that we will be able to help them preventing chronic medical conditions, keep them healthy, so more likely that they will be more successful in school, finish school, and healthier community, because our goal is to keep following up with them even after high school, after studying high school.
Absolutely. Wonderful, wonderful.
Yes.
Wonderful. Thank you for doing this. What have you been doing during COVID? How have services been changed since the students are not on campus?
So due to the school closures and with the pandemic, we actually have been implementing telehealth visits, which include phone visit and video call visits. And this is a great way to make sure, to evaluate patients who need medical concerns and are scared of the virus transmission outside if they have to go to the doctor's office in person.
This is the waiting area where a student or patient from outside can wait. And then as you can see here, you have a chair for waiting. And then back here, you see the door for student entrance. No patient who is here can actually enter through this door. This is one-sided entrance for students from the school to enter. And then you can get out from this door. I also want to share with you the artwork on the wall. It was a competition. We had a student to compete and do this drawing during the opening. We opened this clinic March 16, 2020, and that was right at the day when the stay-at-home initiated. So 3 weeks later, we have to shut it down, and then we open it back again in 2 weeks. So we've been operationalized since then. I want to take you to a tour to the exam rooms here that we have. We have 4 exam rooms. So I want to share with you the exam rooms that we have. You can see here one of the exam room number 2 for the patient. When they come in here, they can actually be seen. Nice lighting, a window to the high school, and also a bulletin board, and then anything that the patient could need. We also have a phone here that actually could be used just in case the student or the patient need to be taken care of in the language other than English, so that we can use an interpreter line. When the patient is seen, a lab work is needed, we also provide lab on site, so patient laboratory work can be done while they are seen, as well as students. And this is the lab area. Now we are at the back area where the staff and the providers have an office here. We also have a vaccine area. As we are operating the school, we want to make sure that vaccine is also something that we carry. So vaccine for children and vaccination refrigerator are here. This also serves as a staff break room as well as a provider break room. That's the end of our tour. Thank you for joining me for the tour of Heart of Ohio Family Health Center, school-based health center at Whitehall Yellen High School. Happy National Health Center Week. Make sure that you wear your mask, stay 6 feet distance, and wash your hand and stay safe.